In the U.S., the Centers for Disease Control and Prevention has suspended shipments of all biological samples from some of its highest security labs. The agency is conducting an intense safety review. It follows what the CDC director calls, quote, totally unacceptable behavior in some of those laboratories. Erika Edwards reports.
An internal investigation at the Centers for Disease Control and Prevention has revealed several serious errors at CDC labs, historically considered world-class in their safety precautions.
I'm disappointed by what happened, and frankly, I'm angry about it.
During a press briefing on Friday, CDC Director Tom Frieden addressed recent incidents, starting with the anthrax scare that potentially exposed at least 80 CDC workers.
The scientists failed to follow a scientifically derived and reviewed protocol that would have assured that anthrax was inactivated and that the material was confirmed to be sterile before it ever left the lab. That should have happened, and it didn't.
None of those workers has fallen ill, but that lab is now closed. In a separate incident, workers accidentally sent a sample of highly infectious bird flu to an outside lab. This week, another government health agency discovered decades-old vials of what we now know are viable forms of smallpox. These errors, coupled with mistakes in 2006 involving live anthrax and botulism, lead to one key question.
How could this have happened at the CDC that all these agents were released in the last decade?
I ask the same question.
Dr. Frieden is likely to face that question again next week. He's scheduled to discuss the latest anthrax scare in front of a congressional committee.
That was Erika Edwards reporting.